6:14 is the time as we get into our discussions this lovely Tuesday. We start today with Dr. Andrew Ford, our dermatologist, and we're going to be talking about something that's usually very common in women, but it can happen with gentlemen as well. So, Dr. Ford, first of all, how do you pronounce these 6 letters?
Striae.
Striae.
Yeah,
Simple
stretch
as that.
marks,
So
yeah.
I was worrying too much.
Yeah, you've had a lot of experience over the last 2 years, so you're getting better and better. But it's a topic that we're all familiar with, as stretch marks are very common, and they tend to be linear lines on the skin, which are at right angles to where the tension is in the skin, and it occurs a lot in younger people or anyone who's gaining weight at a too rapidly. The first slide shows you one of the common areas, which is the buttock area, and the lighter lines that are kind of parallel to each other. They're older ones, and on the right you see a thigh with some raised irregular lines on it.
Yeah.
So stretch marks, I think all of us can identify them. We don't really need to go to the doctor to be diagnosed with stretch marks, but the thing is the concern about their appearance is what
So people
worries
actually
most
try
people.
to get rid of them?
Of course, there's a big industry in trying to get rid of these very common marks on the skin because of their appearance. And you know, they're so common. As I mentioned, any condition that makes you gain weight, let's say puberty or growth spurt, if you happen to be obese because of overeating, or you're diabetic, or if you get pregnant, those areas where you would increase the weight, like the breasts and the hips and the abdomen. This one shows you stretch marks that are kind of early because they're red and they're swollen. But in actual fact, this represents a splitting in the skin that's from the top to the middle layer. It isn't a superficial thing at all. So the splitting involves the epidermis as well as the deeper layer, which is called the dermis as well.
Okay, so does moisturizing really help to stave this off?
Well,
The old cocoa butter routine.
there are conflicting studies as to whether they work. Of course, anecdotally, many people say, well, I used it and it didn't happen. But a lot of it has to do with your genetic makeup and also your tendency, if in your family you get stretch marks, but also how quickly you gain the weight. So it's always good to take care of the skin and try to moderate any excessive weight gain, and that's the best way. But no one can reproducibly say that rubbing anything on the skin like cocoa butter or shea butter or oils or anything like that can prevent you from getting stretch marks.
Wow.
Why do some women after pregnancy lose their stretch marks and others just can't
Well,
seem to?
some don't get it. I mean, there are some of the studies show that if you gain 15 kilos or more during your pregnancy, that makes you more prone to stretch marks, and also how quickly you get it. As I mentioned, diabetes. But there are lots of hormones circulating in pregnancy, and just like cortisol in some people who have Cushing's disease can cause a problem, these hormones can weaken the fibrin in the skin and the elastin in the skin. And that's very important for support of the skin and keeping us looking good, and even keeping us looking younger. These structures have a very important part to play in the integrity of the skin.
Where are men most likely to get stretch marks?
Well, in the growth phase, men usually get them in the back, horizontally.
Around the shoulders as well.
And also if you're building muscle, you can get it along the shoulders and on the chest area. So bodybuilders can get it for various reasons.
What about bare bellies?
Certainly,
just
bare bellies
wondering.
too. It depends on the extent and the speed at which you're expanding. A belly is a very important area. You can get it, but the buttocks, the thighs, the inner thighs, the outer thighs, the abdomen, the lower back, as I mentioned, the shoulders. We've seen them all in these places. But there are some conditions that I mentioned that you can have them. So very common structures. Here you can see it on the shoulder. We have to mention that medications can cause it too. So all those individuals who are trying to do bleaching, not saying that this is a photo of someone who's bleaching, but bleaching and using steroids on the skin, or taking oral steroids or taking anabolic steroids can be a cause of getting stretch marks. But the morphology varies. It can be red and they can look swollen and sometimes, but as they get older, they become white and thin lines. So you can think of it as a scar that's running all the way through the skin. And that's why they're so difficult to get rid of.
So tell us then about this multi-million-dollar industry.
That,
What are these treatments that
thriving
people are
based on these
using?
marks.
Well, anytime there's something that's wrong with the skin and there's hope, there are people who will create things to feed on that hope. And by the time you finish using the modality, the money has already been spent.
Wow.
The fact that many different treatments are tried for stretch marks says that there isn't a perfect treatment, but stretch marks can be minimized and made to look better with various treatments. If you start very early, you can certainly use something called a retinoid, which is a resurfacing agent that's also used for fine lines and wrinkles and acne. So that resurfacing agent can work on it very early when it's red, even though it does tend to cause irritation and make a difference.
This looks different.
Yes, this one is, you mentioned about men, and this is a physiological form of the striae. This is a growing young man, and he has his in the lower back, and they're hypopigmented and thinner as well.
Okay. Wow. And you're saying that even at that stage that we're seeing something can be done there, or?
Yes, there's always something that can be done. The skin type plays a very important role, but as I mentioned, structurally it's from the surface into the middle of the skin, the dermis. So any treatment has to penetrate very deeply to make a difference. So that's why creams don't really work very well. This is a young lady, she's no longer pregnant, but her stretch marks are in the lower abdomen from where the distension was in the pregnancy, but you can see she's in pretty good shape, pretty low body fat, but you can still see the marks. So as I was saying, there you can use the retinoids for it, and I also mentioned now there's some lasers that you can use, which are resurfacing lasers, fractional lasers, which really injure just small areas of the skin instead of large areas. But for people with darker skin, if you use a laser modality that's very harsh and deep, you'll get lots of discoloration. Microneedling is proven to be a newer method that's working very well, because with the microneedling, you actually get some small injuries to the skin, and that stimulates the production of the elastin and the collagen, which is lacking when you have a stretch mark. So microneedling is proven to be a cheaper and an easier modality to try, and it penetrates to the depth that's necessary. And for people who have dark skin, that's a modality that's much more applicable than the lasers. So lasers use heat, or they use different types of methods to cause injury and therefore cause a rebuilding of the area.
What about cosmetic surgery, other kinds of?
Yes, well, if you have stretch marks and lots of excessive skin, you can always get a tummy tuck. And that would get rid of the excess skin,
Stretch the skin out.
and get rid of some of the stretch marks by physically removing it. But then you have the issues with, are you someone who tolerates a scar very well? Do you get lots of thickening, or do you get keloid formation? That's the thing you have to look at. And also your tummy tuck, it has to be done appropriately. If sometimes it can be done too tight and it can affect mobility, or sometimes it can be too loose and you get excess skin that you didn't really need.
Wow.
So I mean, it takes a lot of experience and know-how to do these things. That's why only plastic surgeons do those sort of procedures.
Is there anyone who wouldn't be able to treat their stretch marks, and do you have to catch it at a particular point to really get rid of them?
Well, the important thing is to start early. But in pregnancy, not many treatments are allowed in pregnancy. Even the Retin-A is thought to be teratogenic.
Yes.
So in pregnancy, you're not really allowed to do anything for the stretch marks except to moisturize them. So that's one area. If you have, let's say, Cushing's disease, and you're producing too much cortisol, it's important to treat your disease. And there's some people who have hereditary diseases. Ehlers-Danlos is a hereditary disease where you don't produce elastin and collagen properly, so you tend to get stretch marks. Or if you have Marfan's syndrome, which is another genetic syndrome, you can have stretch marks as well because of the way the syndrome plays out in your skin. But the important thing is to try early. But if you're pregnant, you have to understand the baby is the important passenger and everything else is secondary.
Absolutely.
Are there marks that might imitate this condition?
Well, it is possible, but usually not ambiguous enough to cause a problem with the diagnosis. As I mentioned, just the average person who isn't medically trained can diagnose stretch marks, so they're usually quite clear.
Okay. All right.
Good stuff. Indeed. Before we wrap up, I want to ask you about your conference.
Yes,
last week. How did that go?
The conference was fantastic. The academic aspect was incredible. Everyone was very pleased with it, and we had our lovely sunset cruise. And we had our dinner, lovely. And we spent time at Dr. Duran's house, and we had a wonderful, wonderful time. People always enjoy the conference when it's in Barbados, and it was a total success. We had 114 doctors there, and also about 20 displays from pharmaceutical companies, and so we did our bit for tourism and for education. And our GP session was also excellent. The topics were some of the topics that really bothered GPs the most, and I think anyone who came out would have enjoyed it, as well as got the continuing medical education
Awesome.
credits.
Any new discoveries?
Well, not yet, not
Okay.
earth-shattering ones, but at least we did have some patients with problem areas on the skin that we got some input on, and we should be delivering that news to them shortly.
Excellent.
Oh, good
Thanks.
stuff indeed. Dr. Andrew Ford, our dermatologist, joining us as usual on Tuesday morning and talking about,
Striae? Is that it?
Yeah, Striae.
yeah,
Okay.
skin growth.
Stretch
Speaking
marks.
Stretch marks.
skin growth, stretch, same thing. Speaking of growth, we're going to go to the garden and see how things are growing when Morning Barbados
Peppers
continues.
particularly.
Yes.